we ended up going down to Florida. And that's when COVID hit during March. So we ended up staying in Florida. And down there, everything shut down. So my group exercise classes, things that I would normally do, was no longer able to get involved with. So naturally, you become a little bit more sedentary. And I noticed I wasn't able to go as far walking the dog. I have a big golden retriever, wasn't able to go 2 or 3 miles with him, just maybe a mile, mile and a half. It was like if somebody were to have kind of maybe punched you in the hip and you had that dull ache that was left, but it just was kind of there. And you can manage it pretty well with anti-inflammatory meds. So I was just taking over-the-counter Aleve, and that would get me through the day. I mean, I was able to functionally walk and do a number of things, but as the months went by, and it was my choice to postpone this surgery, as the months went by, it got harder and harder to do that. Motion is lotion, and so the health club I was going to had closed. We had gone down to Florida again, and that club was closed. And so really I was limited to walking the beach, which wasn't really smart because you're on an uneven surface, and trying to ride the bike, which was difficult. I even tried to do exercises in the pool, but that was hard because what I didn't realize with the hip, when you're bone on bone, it's not musculature that you need to strengthen. I mean, they want you to basically do as much beforehand before surgery so you have a really good outcome. But when it's bone on bone, it still hurts, and I was surprised by that. I thought that with water resistance, it would be more comfortable to exercise, and it wasn't. So you become even more sedentary. I mean, you're basically just functionally walking around. You know, you're able to get in and out of your car, but not easily. You're able to maybe get to the grocery store and do basic things, but we weren't doing anywhere near the activity level that we would normally do. I did wait too long for a number of reasons, but again, it's my first time through this. You also kind of think to yourself, well, this really isn't happening to me. Maybe I can just skip this and keep moving on. And then you realize, no, this is really stupid. You need to have had this done sooner than later. Because really, who wants to go through it? No one wants to go through it.
Perfect.